For patients who meet the end-of-life trigger of a hospice consult or a family decision to limit, decelerate, or withdraw treatment, we may approach their family with the option of DCD donation. Donation after circulatory death is the immediate rescue of organs after a planned extubation in which a cardiac death occurs. Patients that meet this criteria are mechanically ventilated, but are terminally ill or have sustained an irreversible brain injury with a poor prognosis. If this patient's family decides to end life-sustaining therapies, we may approach their family with this life-saving opportunity. The DCD donation opportunity is only offered after the decision to withdraw life-sustaining therapies. If the patient's family would like to donate, the extubation occurs in the OR instead of at the bedside in order to reduce ischemic damage. The DCD process is first about the family's desire to end care. So, if the hospital permits, the family can be with their loved one in the OR prior to cardiac arrest, with Life Alliance staff by their side to support their needs. The withdrawal of support and pronouncement of death is done entirely by hospital staff and not Life Alliance to prevent any perception of conflict of interest. This requires attendance from the hospital respiratory therapist, bedside nurse, and pronouncing physician or their designee. If the patient expires within the time frame for a successful organ recovery, usually within 30 to 90 minutes, their family is ushered out of the OR. This is when the surgical team enters, and following a wait time of 3 to 5 minutes to avoid the possibility of an autoresuscitation, begins a rapid organ recovery. Should the patient maintain their stability past the acceptable time for ischemic damage, he or she is not re-intubated, but returns to the unit with their family for continued comfort care.